Hello, everybody. So, as you may or may not know, I'm doing my master's at the moment. So, I'm obviously not going to go into detail about what I'm doing it in or what school I'm doing it at or anything like that. But I will say I've been surprised by how well I've been doing. I don't want to jinx it and I don't want to set myself up for disappointment, but I have been getting straight A's so far and I'm about halfway done. I'm not really saying that to brag. I just get a kind of an intellectual inferiority complex dealing with people in these spheres sometimes. I feel like I'm uneducated or dumb or significantly less knowledgeable or something like that. And it's kind of nice to know that in an academic setting, I can still excel. And that I'm doing a lot better at this than I did in my undergraduate. And that's just partially due to me having my life together more. But that's neither here nor there. The nice thing is, in a lot of cases on assignments, I get to choose what topic I want to cover. And I've kind of been using this as a way to research a bunch of topics I've been wanting to do anyways. So that makes writing the paper easier because it's interesting. Plus, I get the school assignment done and I get my personal research done. Both of which are pretty cool. I mean, it's a lot of work, but it's interesting. Maybe just a side note regarding politics. It's kind of interesting because me not really being a what is normally considered like a conservative in the normal Western sense makes it a lot easier to write stuff because I can write like favorably about state involvement in the economy or social policy, like not talking about certain like things. It's kind of hard to describe, but just on a lot of things, I find I can write fairly neutrally in a way that leaves it very ambiguous as to what position or what side I'm taking. But that would be getting into too much of what I'm actually, my whole degree is in. So I've gotten to cover a couple interesting ones. One course, I did a huge project on minimum income. I haven't done a video on minimum income because I don't really have a definitive answer. If people want, I can try to put something together and maybe just talk about the different ways it could work. I just post in the comments if you want me to do a video on that, and I will. I also recently, I'm doing economics at the moment. Maybe I'll do another separate video. I don't want to drag this introduction out any longer for how I'm finding studying economics, but I got to do a paper on food delivery apps in the time of COVID, which is pretty interesting. I got to do one on Monsanto Bayer because we had to do one on a monopoly or oligopoly. So for this one, we had to do one on market failure. So I figured I've been wanting to look into healthcare for a long time and just kind of figure out why is it such a disaster? Why is it such a mess? Because it's a disaster and a mess in every single country. It's not just a disaster and a mess in America. I mean, it's especially bad in America for a variety of reasons that we'll go into. But it's a mess in Canada. There's always going to be severe problems with it. And a lot of that is just structural and just inherent to this specific topic. So let's just go into how. So kind of one of the basics of economics, I'm not an economist by any means, nor my interest is more in the public policy field. But anytime you're dealing with any sort of good or service, there's always a case of limited resources. Now, in a lot of cases, this doesn't really matter. Like, there's always going to be a limited number of chocolate bars. But generally speaking, you don't have an issue with stores running out of chocolate bars or people who want to buy chocolate bars not being able to purchase them. If you live in Canada, generally speaking, access to water is not an issue for the vast majority of the population. I mean, obviously there's exceptions, but there's limited resources, but distribution and the ability to meet demand isn't really like a problem. The issue is when you get into things, and then you have things that are luxury items like nicer cars, where supply is never going to meet, or rather, the ability of people to afford expensive cars is never going to meet the ability of how many people want. Or sorry, just to take a step back. All the people who want to buy expensive cars will never be able to, or most of the people who want to buy them will never be able to buy them. But by and large, that's not really an issue. You don't really have, I mean, I'm sure there's people who say it, but people who say it's a major social problem that the average person can't afford a Lamborghini or something like that. It's the distribution of resources in that context isn't super important. Same is true for pretty much any luxury item. But that brings us to healthcare, in which case there is, more than pretty much anything else, an unlimited number of potential places you can spend resources. It is probably the most complicated single field, the most vague, the most informationally bizarre field I can think of. And there's so many different places you can allocate resources to. And if a mistake is made, like if resources aren't allocated properly, people are going to die. Oftentimes, a lot of people are going to die. And so every decision involved in it is inherently very emotional, very normative. And the fact that it's so hard to really come up with any kind of, in a lot of cases, objective measurements makes the whole thing even harder, because there is an unlimited amount of potential money we could spend on healthcare. We could keep everybody alive as long as possible on life support. We could keep everybody alive until they're 120 or something, hooked up to machines like it's the Golden Lion throne from Warhammer 40K, where we could take the perspective that we just shouldn't do any type of geriatric care and just let old people die, because the resources would be better put on young people or people who are more economically productive. And so you'll have judgments like that, and these kind of come down to, at least a certain extent, like a value judgment. So when you're dealing with certain things, like a good example of this would be, we call electricity in Canada hydro, but when you're dealing with hydro, you can say, okay, we have this much capacity, it'll cost this much per kilowatt hour, the population needs this much, they're willing to pay this much, are we meeting our, it's pretty straightforward. I mean, obviously there's all kinds of other complicated things, but you can boil it down to a couple easy to understand metrics. In healthcare, that's not the case at all. I mean, I guess you have stuff like life expectancy, but once again, you can hook everybody up to machines and have the life expectancy be 90 or 100 years old. That's not what most people would consider to be a good outcome. Even when it comes to stuff like obesity, you could just issue everyone methamphetamine or give everyone Ritalin, and that would solve the obesity problem. That may not be a good situation for society to be in, but there are ways of solving things or moving the numbers around. There's also the issue where it's just very unclear. Medicine is ironically in a lot of cases more of an art than a science, because everybody reacts differently to everything. And I particularly found this just because I did a lot of research back in the day on psychiatric medications. So sometimes SSRIs, which is the mainline antidepressants, will cause weight loss. Sometimes they'll cause weight gain. Sometimes they'll be weight neutral. Sometimes they will make people more alert. Sometimes they'll make people more asleep. Sometimes you'll take Prozac and it'll work really well, but another SSRI like Cipralex will not work well, even though they should basically work the same because they have similar mechanisms of action. And it's very confusing, and people don't even really understand entirely how these things work. Like taking myself, for instance, I have bipolar disorder, so I take lamotrigine, which was originally designed to be an anticonvulsant. I'm not even sure what the mechanism of action is, like some weird sodium blocker or something. I don't entirely understand how it works, but there's a certain percentage of people, primarily those with Asian ancestry, who take this medication and it results in Stephen Johnson disease and their skin falls off. It doesn't really hurt anybody else that doesn't have that genetic factor. But how do you evaluate the drug? Do you evaluate it as this thing that causes your skin to fall off? Or do you evaluate it as a mood stabilizer for people with bipolar? Or do you evaluate it as a seizure medication? An anticonvulsant, I think is the term. And it works differently. So like for some people, lamotrigine will work really well and stabilize your mood. For other people, it'll do nothing. And then for some people, something like Tegretol will work. Or some people need valproic acid or Depakote, and some people need lithium. And it's very difficult. And if you ask 20 different doctors, they'll have 20 different solutions. And that's just psychiatric medicine is probably like the most nebulous one. But even if you take something like what type of antibiotics to prescribe, sometimes people react well to them, sometimes people react really negatively to them. I know when my doctor gave me Zopiclone, I react extremely strongly to it. So I get like really, it has a really strong effect on me when I take like a fifth of a minimum dose. Like if a minimum dose is like 4 milligrams, I'll take like less than 1 and I'll get like really strong. Out isn't really, but it'll have a very strong effect on me. So, and then one doctor will say, no, that's bad, that causes cancer. Another doctor will say, no, that's fine. You see this with vaccines. There's a lot of debate over, and you kind of have to try to make decisions based on high level metadata. But that can be really difficult because once again, you're aggregating all these different cases of very specific and individualized circumstances. Like once again, you can see this with regards to COVID, where the cause of death is like a mystery in a lot of cases. It's a lot of the people in question have comorbidities, but they don't really count those separately. So someone can be 800 pounds and get COVID and die, and someone can be like a perfectly healthy weight and get COVID and die, and those will be counted the same. They're both COVID deaths, or just stuff like that. So it's very, very difficult to kind of come up with anything like that. And that's us looking at this from a high level, trying to put the information together. This is kind of a best case scenario. If you're actually one of the people involved in any aspect of this, it gets way, way, way worse. So let's just maybe take let's just drill down a bit. So in Canada, America, and I don't know what Western countries this works in, but it actually doesn't really matter even. Doctors, I would assume, have no idea how much medications cost. Maybe they might because some patient told them. I really doubt that in most cases they know how much roughly a medication costs per month. They might know if there's a generic or not just because they prescribe it a lot of the time, but they don't really know. So you might just go see them. They'll be like, oh, well, here, take this. And it's like a brand name antibiotic when there's something similar on the market that is much cheaper. They don't really know if the person in question necessarily has health insurance that'll cover it. So like I used to take Cymbalta, which was like $130 Canadian a month. And when I was on health insurance, that was fine because my health plan covered 100% of that. But when I went off health insurance, I had to pay for that out of pocket, which I mean was possible, but it is a very different circumstance. Whereas I take Prozac now, and Prozac is a generic drug that's like $16 a month. It's extremely inexpensive. So the situation the doctor's in is they'll probably just prescribe whatever they feel like prescribing, and they might not know all of these things. And this was actually something that the Trump administration was trying to really push hard, which is transparency in pricing of medical services. So what they were trying to impose for people who receive Medicare Part D, I'm not going to go into detail, but basically it's American government-funded prescription drugs, is doctors have to use this real-time tool. So when they're prescribing the medication, it'll tell them what the average price is there a close substitute, how much the different prices are involved. It'll also display through medical health records what insurance their patient has, how much of each one it would cover. And that dramatically reduces the amount of information asymmetry. So the doctor has a much better idea the circumstance that their patient has. But that's only one aspect of it. Does the individual person know anything about how much any of this stuff costs? No, like generally speaking, at least in my experience, they don't give you an estimate how much these things are going to be. I mean, in Canada, we don't pay for, like, if you go see the doctor because it's government funded. But if you go to the dentist, they normally don't tell you ahead of time. Optometrists, they generally don't. If you get a prescription fulfilled, they generally charge you after the fact. From my understanding in the US, generally speaking, they will not give you an estimate when you go to the hospital, and they will not tell you if you're covered or not until after the fact. And that was kind of another thing that the Trump administration was trying to do, was they tried to pass regulations to make it so that all the different health industries would have to be transparent in their pricing. They'd have to say, okay, upon like entering the hospital or calling ahead or looking at a government sponsored website, X procedure will cost X amount of money. This is what the cost breakdown is. This is how much is going to be covered. Insurance companies will have to put on their websites, this is how much we cover for this procedure. These are the hospitals where it'll be covered. And they'll have to be kind of upfront with the whole thing. And I mean, there's a whole bunch of issues with that. Like, do people really have time to go through all of it? But that's at least something. That's at least doing something to help the person with the information asymmetry. Because you might have the same drug at multiple pharmacies that's sold for wildly different costs. I know, for instance, dispensing fees I've seen them vary from like, I don't know, $7 to like $26, which is a big difference. And some pharmacies will charge one dispensing fee for one medication, and some will charge, sorry, for one if you're there. So if you get like three, they'll charge it once. Others will charge one for each separate thing you get. And there's not really a public place. Like, there's not really pharmacies don't have like a menu like a restaurant, or you can't go to their website and be like, okay, how much is Prozac, or I guess fluoxetine? How much is fluoxetine? How much is lamotrigine? And then compare that to another pharmacy. They just don't do that. And so the idea being that if you could reduce that information asymmetry, customers will have a much better time of it. The other issue is it's not just with regards to pricing, it's regards to basic procedures. Medical care is extremely complicated. When it comes to something like a car or a house, you can at least, as an average person, go, oh, that car runs. That car makes a weird noise when I drive it. That car's a gas guzzler. You can at least, like, people have some understanding of these things. Most people have no idea how healthcare works. They have no idea what different illnesses are. They have no idea what the medications involved are. So they just basically have to do whatever they're told. So, like, your doctor will, and I know this is the case for my dentist. My dentist has me over a barrel. Like, basically, they can say, oh, you need a filling there, you need a cleaning there, you need an x ray. And I'm just going to pay whatever it is, because the idea of losing my teeth is so scary and so horrifying that I'll pay just about any amount of money. And you can go ask another dentist, but generally speaking, doctors don't like to do second opinions because it leads to people getting in on their grift, more or less. And once again, doctors can have very strong opinions. Like some may just really dislike something, some may really like something, and they won't make this clear normally that it's a subjective or a personal opinion. So the person in question is just like has no idea what the hell's even going on. They don't know how much things cost. They don't know what any of these things actually do. They don't know how necessary any of it is. So it's extremely easy for them to be strung along. And once again, if we're not even like assuming we're going to get into conspiracy territory where the health companies and the pharmaceutical companies and the doctors are colluding together to screw people, which they certainly are, but even beyond that, there's the simple fact that people really have no idea what the hell they're even doing. And none of it really makes any like sense. You have to really sit down and like try to work through it. And that's probably partially by design. But I think that's just kind of an inherent problem with how complicated medical care is. How like I mean, just look at something like nutrition. And I think nutrition is one of the biggest bullshit subjects. You have people who be like, you need to eat an all protein diet, eggs are good. And then other people say eggs are cancer. And then people say carbs are bad. And then other people say, well, carbs are sometimes okay, but only certain types of carbs. And then other people say, well, eat as much sugar as you want. And it's like, who are you supposed to believe? Because these are all mutually exclusive and they all have data to back them up, but they can't all be true. And the average person is like, they can't make heads or tails out of any of this. So they just basically have to do what they're told. And a lot of the people in the system are just as confused as you. They have no idea what's going on. So that's a big problem. And I'm not sure there's really an easy way to get past that. I think they're definitely through computerization, although that does raise a bunch of privacy issues. But through better information sharing, I think could definitely help. But and I think it is good. I mean, people can make fun of WebMD or any of these like online drug review sites or whatever. I've always found them very useful because you at least as a consumer can go into the doctor's appointment and they bring out they're like, "Well, we want you to take Depakote." And you can be like, "Look, I've heard that that causes hair loss and liver damage." And you can at least get the doctor to hopefully like explain to you, oh no, that's not, I'm not giving you a dosage that'll be that high. Or if you express your concerns, maybe you can kind of try to get them to prescribe you something else that has a different symptom profile. So I think it's good. I think that's a lot more available, and that information asymmetry has been somewhat gotten better. But overall, that just kind of persists. There's also the whole issue of healthcare industry being a massive moral hazard, one way or the other. Moral hazard, from my understanding, is there is incentives for people to act in a bad way. So, like one of the more common moral hazards we've had was during the financial crisis, where the bailouts were a moral hazard because banks basically realized they could do whatever they wanted, give out whatever bonuses they wanted, be as risky as they wanted, and the government would bail them out and eat their losses. So that encouraged a really bad environment. So the problem you have in healthcare is over or underutilization, and these are problems in both public and private healthcare systems that functions pretty similar, or in mixed ones like Canada. So the problem with overutilization. So because of the way healthcare is, in all cases, basically people have some form of health insurance. Even if it's not like direct, like you don't have an insurance card per se in Canada, but everybody has health insurance. Even if the government is just subsidizing certain things, that is a form of health insurance. So the point is, in I don't think any country is healthcare simply a matter of you walk in, you pay the doctor the exact amount. In all cases, you're done. There's always a third party involved, be it an insurance provider, being it the government, being it somebody else. So my point being is that generally speaking, the person in question is not paying the full amount of money, at least not up front. So maybe just to give an example, my current dental plan I get through my school covers 80% of dental costs up to a cap of $1,000 a year. So I'm only paying 20% the cost of dental care. So to me, dental care is 80% cheaper. So the incentive for me is to use that. I mean, why wouldn't I? It's okay. So I don't want to get too much into equations, but if to use that $1,000 worth of dental care, if I'm my math is probably off. I'd only have to spend what, like $200 of my own money to get $1,000 additional utility. So I mean that really encourages me to use it. So even if it's like maybe an extra cleaning or something that's not strictly necessary, the incentive is there for me to take that. If I get 100% drug coverage and it covers it, I might as well get the slightly fancier version of the drug. Like if there's an XR, there's like some super or evergreen bullshit. There's no reason for me to not get that so long as it's covered. If you have physiotherapy or massage therapy or something like that as part of your health plan, you might as well use it. I mean, there's no reason not to use it. You're not paying directly for it. You're paying indirectly in the form of your premiums, but that's very abstract. It's kind of like you go and you spend your $1,000 in physiotherapy and you don't immediately your premiums don't immediately increase by $1,000 because it's spread out so widely. They might increase, I don't know, by a couple cents because you and everyone else is using it, but it's very indirect, and the benefit to you personally still far outweighs whatever disincentives or problems will be made by you using the service. So like if you use your cap for everything and you get it through the employer, maybe your health insurance fee will go up by like $10 a month, but you got like $4,000 or $5,000 of stuff out of the bargain. And the problem is a lot of that stuff is not helpful. Um, if you were having to pay for it, you wouldn't get it. It's not necessary. It's kind of a waste of resources. And you have that issue a lot in public systems even more because you're not paying. So like the cost of you going to see the doctor is basically zero. Now there's wait times and you have to drive there and that kind of thing, but say I have like I don't know some like tiny rash or like a pimple or something. So long as I could like get a spot, I could go to see like a dermatologist for like a pimple or something like that. It's like there's not as much of a discouragement if I'm not having to pay any money along with it for that sort of thing to happen. So this is a big issue in Canada where people will just overuse the system and things that they can treat themselves, they'll just go to the hospital for, or they'll go to the doctor for, or they'll say, "Oh, we might as well go see a specialist, even if we don't need to, just because there's not an additional cost involved in it." So you have that issue, but on the other hand, you have the issue of underutilization, which is also a problem. So that's where things are expensive, and so because things are too expensive, people aren't using services that. So underutilization is when people aren't using services that they should be using. So an example of this might be diabetes drugs. So drugs to control diabetes will hopefully prevent the person from having limbs fall off or going blind, or worse treatments that the system will have to absorb. But if you're trying to discourage people from using resources and you put like a copay or cost sharing period, let alone one that's too high on that sort of stuff, people are just going to use it less. And if people aren't taking their diabetes medication or think it's too expensive, you're going to have a human and economic tragedy. And then you kind of get into which ones do you want to encourage, which ones do you want to discourage, what do you ration, what don't you ration. And it just becomes a mess. And there's so many value judgments and there's so many arguments that go one way or another that regardless of how the system is going to be structured, it's going to be a disaster. It's going to be a mess. That's not to say that the current system we have at the moment is optimal. I mean, obviously, the American system is just beyond like a disaster. The Canadian one, I think, I've been thinking about it. I think we should introduce some sort of cost sharing, at least for certain procedures. I don't know. But I don't know. Hopefully, you found that kind of interesting. Hopefully, you learned something. God bless, and more exciting quality content to come.